Hi folks, I'm Dr. Basil Cardozo. I'm professor and HOD at the Gomantak Ayurveda Mahavidyalaya and Research Center in Shiroda, Goa. I have been practicing for the last 16 years in the state of Goa. I have got into the Ayurvedic college 16 years back. I started my career as a lecturer, post which I am now at the post of the HOD and as a professor in the same department. At the department we have UG and PG as well. We have an intake capacity of 60 students at the UG level, and we have an intake capacity of 6 students at the PG level in our department. The best part about our department is we impart the students with a total clear Ayurvedic knowledge. We try to be, as far as possible, teach them how to practically implement whatever they study from the texts, and for the implementation purpose we try to provide them all the modern data and knowledge which is required. Not only are we teaching them how to integrate the modern science in terms of the availability of clinical examination techniques and tests, but when it comes to the practice, it is totally on Ayurvedic terms and conditions. We ensure that none of our students ends up practicing modern medicine. For that purpose, we make them aware of our texts, for which we have regular classes, and which updates their knowledge in terms of the Samhitas by having Patan classes for them. And we also have classes where these students will be taught how to decode what is in the text and implement it clinically. The most important thing that we try to do is clinical implementation of the text or the textual knowledge. Of late, you might have also seen that there is a lot of digitalization which is taking place, and for that purpose we are making our students aware of the digital techniques and taking them to another level, where we are talking about innovation in the Ayurvedic clinical practice, how they can be an entrepreneur, where they need not just look about practice, but they can look about taking their practice to another level and go globally. With Ayurveda, with the world becoming a global village, it has become a necessity to take Ayurveda to the whole world, and for that I myself regular visit Germany and Australia, where I have a small practice which I do, and therefore I encourage my students also to look globally. At my personal level, I have done my graduation or BMS from Bharati Vidyapeeth Deemed University, Pune. I have done my post-graduation from ITRA, Jamnagar, and I have been in practice for the last 16 years. I run 2 Ayurvedic clinics called under the brand name of Leslie Ayurveda Clinics. One in Margao in Goa, and the other one is in Tolekanto Valley in Goa as well. My wife and I together we run these clinics where we have a regular attendance of patients. I would like to talk about Sandu as an Ayurvedic company, where I have been regularly using Sandu products since I specialize in the field of Rasayan and Vajikaran. My thesis has been on Vajikaran, and therefore I specialize in this field. And the Sandu products like Vanari and Makarprash are things which I regularly use in my clinic, and they have been found very, very efficacious in my regular clinical practice, and therefore I do recommend that they should be used on a regular basis. I also have been using Wupin for almost 16 years now, and I find it very efficacious as well. Besides that, most of the Sandu products which I have used, the Asavan, Aristas, which I regularly use in my in my clinic, are also very efficacious, and therefore I recommend that we all should be using it. With this, I would like to conclude by saying yes to Ayurveda.